In today's video, we'll discuss about Ehlers-Danlos syndrome. So coming on to the introduction, it is a name given to around a group of more than 10 different inherited disorders, all involving a genetic defect in collagen, connective tissue synthesis, and structure. All right, so basically it is a disease of collagen. Right now, coming on to the other names, in other names you can remember cutis hyper elastica, then tenascan xds, then lysyl hydroxylase ds. All right, now coming on to the classification, it is basically divided into 5 classifications: type 1, type 2, type 3, type 4, and type 5. In the first type, what you see is you see hyper elasticity of skin plus hyper extensibility of joints. Then in second one, what you will see is there will be milder type 1. In the type 3, you will see that the joint hyperextensibility or hypermobility is more predominant than the skin changes. Then in the next one, you will see skin changes. So there will be excessive scars and hyperpigmentation of skin. In type 5, what you will see is rupture of large vessels and hollow organs, leading to sudden death. All right, so now coming on to the etiology. In etiology, what we see is all of them are combined with a joint etiology, that is basically the defect in connective tissue. Now coming on to the clinical features. Now in clinical features, what you will see is, first of all, you just mention the type 1 again, write about hyperelasticity of skin, then hyper mobility or elastic extensibility of joint, then mention about the fragility of skin and blood vessels. Basically what you will see is there will be excessive bruising. Okay, now due to this excessive bruising, it is given a characteristic keyword, all right, which is cigarette, basically crumpled cigarette paper. Okay, you need to remember this as well. This is the very characteristic keyword that you need to remember. Then there is one more keyword which is rubber man. Okay, this is the very characteristic question and is usually asked with this name. All right, now some characteristic features are frontal bossing, epicanthic folds, protruding ears, wide nasal bridge. All right, and hypertelorism. Now now we will talk about oral manifestations. Now in oral manifestations, what you will see is the gingiva. It is very friable. All right, basically what you will see is it is very fragile, bleeds after brushing. Then in gingiva, what you will see is gingival hyperplasia. I have also discussed all the conditions, other conditions that cause gingival hyperplasia in one of my videos. You can check it out in the oral pathology playlist. Also, what you will see is fibrosed nodules. Now, in skin lesions, also you will see them as a fibrosis of fat. Okay. Then there is a hypermelia. mobility of TMJ. Now, due to this, there are frequent dislocations. Okay, then what you will see is there is basically a retarded healing. Now, let's talk about teeth. Now, in teeth, very characteristic features, there will be lack of normal scalloping of dento-enamel junction, due to which there will be a lot of irregular dentine formation. Also, you will see that there will be pulp stones, hypoplastic enamel, also extensive periodontal destruction, and positive Gorlins sign. Okay. Now in histopath, what you will write is the skin and the connective tissue. They give us a diagnostic abnormality. Also, we will observe some ultrastructural changes in collagen. In treatment, there is no specific treatment, but however, if there are surgical interventions, so it should be done very carefully because of difficulty in healing and suturing. All right, so this basically completes our Ehlers-Danlos syndrome or the rubber man cutis hyperelastica. You just need to remember all of these names. So yeah, thanks for watching.